Hello people, in this video let us look at this anatomy question that they have asked in the exam 13. They've asked that a 30-year-old lady went to get her blood drawn for some routine blood test. Okay, a 30-year-old lady has gone to get her some blood test. At the lab, the technician will select a vein that ran across the roof of the cubital fossa for collection of blood. So they're telling you also cubital fossa roof, some vein is there, that one he is choosing. Why they're asking? Which vein did the technician select for drawing blood here? Okay, something which is in the roof of the cubital fossa. Explain the anatomical basis for the selection of this vein. Why did he choose this vein? Okay, so which vein and why? Okay, so for the first one he is giving 1 mark, and the second one, why is he choosing? 2 marks they're asking. Just 3 marks question, remember. So which is the vein in the roof of the cubital fossa? Yes, it is the median cubital vein. So if you can quickly draw a diagram, just draw like this and say that this is the right cubital fossa. Okay, this is, you label it as the right cubital fossa and name this as the arm, and this is the forearm. So this is the elbow, and here you please draw the veins, very important. Here you draw the basilic vein, here you draw the cephalic vein, and here you show the median cubital vein which is draining the cephalic to the basilic. Okay, cephalic vein and all, they actually, where are these veins going? They're trying to drain, right? So the blood is flowing towards your head. Okay, so you can understand the why they have named it as cephalic vein. So here is your vein of importance for you. This one you will label it as median cubital vein. Please expand and write. And then you will label this as basilic vein and this one as the cephalic vein. And then you will say that this is the roof of right cubital fossa. Okay, done. Now, which vein did the technician select for drawing blood? Median cubital vein, which connects the cephalic to the basilic vein in the front of the elbow. Okay, and explain the anatomical basis for the selection of this vein. Explain the anatomical basis for the selection of this vein. Anatomically, why did he choose this? Okay, so give it a thought. Where else would you pierce the person who came to draw blood draw? You would definitely prefer something which is superficial, easy to find, right? You want to make your job easy, so you will find something superficial, easy to find, and hopefully the patient will cooperate with you. So if the skin here is more not so sensitive or something like that, you want the patient to be comfortable. And then this vein is protected from the brachial artery by bicipital aponeurosis. Is that a point? Let us look at it. So here you can see this is the roof and this is the content. So here you have the vein, right? This is the vein that you want to pierce, and there is an artery also somewhere in the same way. But the aponeurosis that you can see here, the bicep brachii tendon is coming between this artery and this vein. So they are saying that this vein is protected from this artery by this aponeurosis. Okay, if that is even a point. Then coming to the main thing you have to write here is stability of this vein. See, whenever you pierce somewhere else, right, the veins, just try piercing somewhere else, especially over the palm, dorsal surface, they will give some IV injections and all, right? Cannula, when you try it, the vein moves. However, this one will not slip away during piercing. Why? Because it is fixed by perforators. Perforators means what? The ones that help the drainage, venous drainage, right? So perforators are nothing but connections between the superficial and deep veins. Something like this you can write, deep vessels. So these perforators will fix this vein. It will not move when you pierce it. Okay, this is very, very important point. Okay, and you can say that they will prefer the left over the right cubital fossa, because if the patient is using right hand for doing things, you don't want them to feel uncomfortable by the piercing. Okay, that's all. So these are the reasons. They'll give you 2 marks if you write all these. Okay, so another PYQ completed, anatomy, upper limb. Bye bye.